Okay, good evening. I am Gail Formanak, co-president of the League of Women Voters of the Villages Tri-County area, which covers Lake, Marion, and Sumter counties. I will serve as moderator of this Meet the Candidates Forum. My timekeeper and right hand tonight is our co-president, Bonnie Field. You want to wave, Bonnie? There's Bonnie. Okay. The League of Women Voters is a trusted, nonpartisan organization celebrating its 100th anniversary this year. While we never endorse a candidate, we are directly involved in shaping important policy issues that keep our community and state strong. As League members, we have opportunities to educate ourselves and others on local, state, and national issues. The League wants everyone to vote. So we actively encourage participation at the polls through voter registration and education efforts, such as this forum and our online voters guide, vote411.org. In addition, our local league has a speakers bureau and offers education on topics such as the constitutional amendments, which will appear on this ballot, and other topics such as the history of women's suffrage and separating fact from fiction in the news. I would encourage you to visit our website at lwvrifl.org to learn more about our work. We are happy to present our Meet the Candidates program. Under normal circumstances, we would book a room and invite the broader community to attend. But obviously with the current health crisis, we're forced to use this virtual format and are hoping that all the technology pieces cooperate tonight. We would typically ask audience members to submit questions. However, that type of interaction just didn't seem very manageable to us. So we hope that those asked tonight cover the issues of concern to you. The meeting is being recorded and will be available on our League's website in the near future. And it is being broadcast on our League's Facebook Live right now. So let's get started. Each candidate will give an opening statement of up to 4 minutes on this first one, explaining your understanding of the role of this board and your interest in holding the office. Then this will be followed by questions with each candidate having the opportunity to respond for 2 minutes. We typically would determine the order by drawing a card, and since that wasn't possible, we will use alphabetical order to then rotate the order of who's first each time. Okay, and Sue, I see that you are muted. You'll definitely want to hit unmute before your turn to respond, okay? And as far as the recording of this event, they should not be, even recording of this computer screen cannot be used without the permission and approval of the League. We will only allow the video of this event to be broadcast in its entirety. And so I just want to make sure that you know that. So again, this is featuring the candidates for the open seats on the North Lake County Hospital Board. So to again reframe the first question, where you have 4 minutes, what is your understanding of the purpose of the North Lake County Hospital Board, and why are you interested in serving on it? It looks like Dr. Duncans is first up as a D. So take it away. Begins now.
First of all, I would like to thank you, Gail, and thank Bonnie for having us here today. And yes, and before I answer that question, I would like to just provide a short story, if I may. When I was in my late 20s, I became a single mother. And so I was working full time, but unfortunately, the organization could not afford to provide me insurance. So I was working mother with no insurance. And every day I would be so worried about something happening to me or my 3-year-old daughter. And so that was such a magnitude on my life. And one particular day, Naomi had a high fever, and it was in the middle of the night, 2 o'clock in the morning, early in the morning. I grabbed a taxi to go to ER because I did not have a primary doctor. I waited in ER holding my daughter in my arms for several hours before someone could see me. Once they saw me, they treated my daughter like she was a dirty rag, and treated me like I was inhuman. Saw me for 1 or 2 minutes, gave me some children's Midol and sent me on my way. Well, my ex-husband had great insurance and he lived in a great community, Queens, Jamaica, Queens. And so the very next day, he said, let me take her because he had insurance. We went to a very nice hospital where there was no waiting period. And come to find out, Naomi had pneumonia. I was treated, everyone was treated with respect. There was quality services and quality care. So when this position became available, I jumped at it because A, I knew how it felt to be uninsured, to be treated like I was inhuman, and the importance of having quality care for those who are underserved and uninsured. That does not mean that they should get any kind of less quality than the insured. The role of board members is to ensure that the monies that are taxed from the homeowners are allocated to the right services and quality care that will help the uninsured and the underinsured. They are allocated to community hospitals and they are allocated to community clinics. And this, if I had had a district that allocated money when I was an uninsured single mom, then Naomi and myself would have been taken care of. I also understand that the board member decides the percentage of millage tax that will be taxed to the homeowners. Currently, it was discussed in the last meeting that Pam and I went to, the budget meeting, that was going to be approximately 895 millage tax, which would then serve the administrators, the hospitals, the clinics, and still have some left over for emergency. The interest in the board, I think that I have let you know by my story. I don't want anyone to have to suffer the way that I did. And because you are uninsured does not automatically mean, thank you so much, that you are lazy and you are unemployed. Thank you so much.
Thank you. Okay, so next up, same question again. What is your understanding of the Lake County? Okay, Bonnie, you got your.
I'm trying.
I'm gonna mute you. Okay. Okay, there we go. Okay, so again, this question now will go to Ms. Hooper. What is your understanding of the purpose of the North Lake County Hospital Board and what is your interest in serving on it? And I had to mute you because there were some issues. So if you could unmute yourself, Sue, before you answer.
Okay, maybe I should go close the door. Maybe
That might help. Well, we won't start your time until we were getting some background noise that was interfering. Thank you. The challenges of Zooming from home when other people's are doing their own thing too. Oh,
better, I hope.
that's good.
All right, as far as the North Lake Hospital District, I'm really for transparency. I want people who, I want the property owners to know that they are paying for it. I also want to know who provides the services, and I understand there are 5 entities that provide services for indigent care, which I believe indigent care is very, very important. My son has PTSD, and he's got military, but
Yeah, you're kind of fading out a little bit, Sue. So I don't know where your microphone is, but you might want to be pointing toward it.
Maybe if I get closer.
Yeah, I'm not sure what happened. It was fading out. Okay.
Okay, but anyhow, my son has PTSD and he has no real income. He was in the military, but he won't apply for care or what do they call it? He won't apply for disability. But anyhow, I take care of him. And I just think that I just want everything to be transparent. I want people to know how much money goes out to each of the entities. I'm very familiar with all 5 entities that are getting the money. I actually worked at First Baptist Leesburg, and I know they have a wonderful clinic up there. And I also know that St. Luke's here in Eustis, where I live, has a wonderful clinic. And Lifestream, I take a young woman to Lifestream. I seem to be the free Uber for a lot of different people. As a matter of fact, I may have to leave this meeting because I just left a 90-year-old woman up at the urgent care in Mount Dora, and she had some stomach pain, so she's going to call me when she has to leave. But anyhow, it is important. I'm familiar with both hospitals. I just want to have everything out in the open, and I guess that's mainly why I am running for the office. But it looks like we have a lot of fine ladies, so whatever. All right.
Thank you. Okay. And Pam Janelle. So the same question, your understanding of the purpose of the hospital board and your interest in serving on it.
Okay, thank you so much. The purpose of the board is to allocate, as Melody said, the taxes that are collected and make sure that they're to provide some oversight to the way that those funds are spent. And one thing that has impressed me about the district is its transparency. There is a website where you can see every penny that comes in and where it goes out and which inpatient and outpatient clinics are being funded through that care. Using that list, Melody and I went and visited with the administrators for each of the 5 entities that are funded, and they are more than happy to explain everything that happens in their clinics. It's a fairly transparent process, and the more you ask, the more you know. So I want to especially thank League of Women Voters for 100 years of women's suffrage. And for their ongoing work to ratify the ERA, and locally, of course, for putting on this forum this evening. I am running for seat 1. It's Catherine Hansen's seat. She has worked for years to make high quality primary and specialty care accessible to district residents, no matter what their financial situation. And I want to protect that legacy by pushing for the continuation of the medical home model. I think that our community clinics really exemplify what community medical home is, and their partnerships with our public healthcare systems just make that a more rounded package. I think my work history has prepared me. My early work background is social service and community-based organizations where I built relationships with volunteers and community partners and other stakeholders, and also learned that people on the margins, whether they're there because of poor life choices or because of circumstances completely beyond their control, those people are almost inevitably working toward the center, and the district supports that movement to the center. I've earned a bachelor's degree in psychology at UCF, a master's degree in health informatics at University of Illinois at Chicago, which I used in the last decade of my career at Florida Hospital and Advent Health, where I learned how to seek out evidence and facts to improve healthcare. My commitment to this district to allow our healthcare providers to continue to provide quality, accessible healthcare to all residents of the district is unparalleled. And I hope you'll vote for me on November 3rd, sooner if you can. And please encourage your friends to do the same. And thank you, League, for this opportunity.
You're welcome. Okay, so thank you. That was the first question. The second question, which will be going to Ms. Hooper first, is what background, education, or experience and skills do you have that would contribute to the success of the board and its mission? Ms. Hooper?
Okay, background, I am a realtor, and I also have worked with First Baptist Church up there in Leesburg. I worked on the home for homeless people, and I also have, well, I guess I have a degree in interior design, but that's not relevant for this particular thing. I just have a big heart. I love helping people. Most of the people that I work with in real estate are first-time home buyers. I guess that's basically why I wanted to get onto this board, to let people know what they're paying for, how much they're paying for it, how the money's being spent. And I'm glad to see that Pamela's already done all that research and is well versed in it, it sounds like. But it's just something that someone suggested, Sue, you need to do. And so I signed up.
Okay, thank you. Same question now to Ms. Janelle. You kind of explained some of your background and experiences already, but how will they contribute to the success of the board and its mission?
So the last decade of my career was spent with Florida Hospital and Advent Health. I worked there as a clinical research coordinator, an outcomes analyst, and a project manager at Creation Health Research. I learned to work with many different community stakeholders, particularly on a project with the Dr. Phillips Performing Arts Center. There were many community stakeholders there, and we had to have everybody working toward the same goal at the same time. That was quite a juggling act. As I said, seeking out evidence and facts to improve healthcare and really looking at the data, and does that data say what we're being told it says? Is the data source accurate and is it appropriate? And looking at the hospital district budgets, incoming and outgoing, that has been a real exercise in looking at that data. Does it add up? Does it make sense? And it sure appears to. I retired late last year. Since I retired, I have been building my skills as a naturalist, and that requires an eye for detail and a real appreciation for how interdependent all life is. And I think that health and healing can be found in nature. What benefits the disenfranchised among us improves the community, improves the quality of our community, and the district really contributes to the health of our community ecosystem. So I think that all of this works together to prepare me to serve on the board.
Okay, thank you. And lastly, Ms. Duckins, please answer, Dr. Duckins, I'm sorry. Would you please answer this one? What are your background, experience, or skills that would contribute to the success of the board and its mission?
Yes, and thank you for your question. I would like to first preface this by saying I have been blessed to continue my education. I gained a bachelor's degree in music. I gained my master's degree in education and psychology and my doctorate in educational leadership. And so I was also blessed to live abroad for 8 years. I have been a public servant as far as being an educator and an administrator for over 20 years. I've worked with all types of communities, all different means and walks of diversity. But I want to say this because I think the main element for someone to create a successful environment is the heart. And I can tell you all of my academic accolades, and I can tell you all about my experiences, but my heart is what will be the driving force, and what is the driving force that will push me to want to create community outreach, to educate the community, to bring healing to the community. Right now, there are over 90 million uninsured and underinsured individuals in the United States. COVID is rising by the day. We need to have someone in there that has a heart and a drive to bring the community and understanding that they have someone, an organization there that will help them. They don't have to hide because they're uninsured, or they don't have to hide because they don't know where to go. I think it is very important that somebody who is in this position has the heart to reach out to the community and say, you don't need to be ashamed because you're uninsured or underinsured. You are ill. We have the means to help you. Thank you.
Thank you. Okay, on to the next question, which will go to Pam first. Do you support the current funding structure for the hospital district? And if you think it needs to be changed, please explain how and why. You're muted, Pam. Okay.
I just finally found my unmute.
Okay, good.
Every time I think I've conquered this technology, I learned that indeed I have not. That's a very simple question to answer. I think the funding mechanism is just fine. There are ideally 6 board members who look at that maximum 1 mil and determine, are we going to spend the whole 1 mil, or are we going to knock it down to 0.9 or 0.8? And I think right now it sits at 0.895. On my tax bill, that's less than $20 a month. I live in a nice home out in Eastlake County. I think that, you know, less than $20 a month, I can handle that. It's actually, I take it back, it's less than $10 a month. So I think the funding mechanism is fine. I think that the transparency of how it's taxed is quite easily available to anyone who takes the time to simply ask. It's a relatively simple formula. It is explained at the budget meeting where these numbers come from and how they make the calculation that they've made. And I think that is sufficient.
Okay, thank you. Next up on this question is Melody. Muted, yeah.
I keep forgetting I'm muted. Thank you so much. And, you know, I want to co-sign with Pam. I don't see any errors in this. The amount that they're asking is 1 mil, even a little bit less than 1 mil, which equals out to maybe $10 to $20 a month, 120, maybe 150 per year, depending on the price of your home. But I would just like to use this as an example. Again, these are clinics and hospitals that are paid for by the community, excuse me, and for the community. So for instance, UF Health and the other hospitals get approximately 3 million or 3.5 million each from the taxpayers' funds. That helps, that's just one element, which helps to pay for approximately 353 beds. They have 18,866 inpatient admissions. ER, they see 43,993. Burst, 1,084. Surgery, 6,468. Heart catheterization, 7,464. Open heart surgeries, 539. All of this is not paid for by the patient. So I think that's a pretty good deal for $10 a month, approximately. And it just sickens me. It truly does. when you have people who are nickeling and diming this percentage, when one day illness does not discriminate between Democrat, Republican, Independent. One day you could be working, the next minute you're unemployed, and you will need to see someone. And you either pay now or you pay later. So for everything that you're getting, for $10 a month, I think it's worth it, more than worth it.
Okay,
Thank you.
thank you. And Sue, how would you address this? Do you support the current funding structure? And if you think it needs to be changed, how would you do it?
Well, from what I understand, am I muted or am I
No, you're
unmuted?
good. You're good.
Okay. And all this techie stuff kind of gets to me sometimes. I'm not really concerned about, because I think, you know, like everyone else has said, the amount of taxes that go actually to the hospital district is pretty minimal. My interest is more on how it's being spent and how many actual patients each entity gets and what is the cost of that. You know, what are their costs? So evidently I did not know that this was all online. I'm pretty busy with real estate right now. It's going crazy, but I think it's good to know that this can be looked up. And if anyone wants to know, you know, what the expenses are or anything, I think we should be able to tell people you need to go to such and such a website and look it up. And then I think people will be more happy with it if they knew exactly where the spending was going. And I guess that's about all I have.
Okay,
Thank you.
Okay, the next question, which is going to Melody first. In the budgeting process, what would be your priorities for funding services?
Thank you so much, Gail, for that question. And before I answer that, I would just like to address Sue. Sue, that's a very good question as far as how many people are being seen, and I think that that's very important. And anyone can do that research. So if you go to certain clinics, like Community Health Center, they have been seeing anywhere from 600 plus individuals per day. Even when the pandemic was at the highest, believe it or not, they got the highest numbers of patients needing mental health. Okay, and so I think it is a matter of going to these clinics and hospitals and taking a tour and speaking with administrators, because what we're hearing a lot of is, well, I don't know where this money is going. Well, I would like transparency. I want to know how many people. Well, the first thing to do is to go and visit. To answer your question, Gail, I would probably say it is very difficult to say one area. But I found when I went to go visit Community Health Center that women's healthcare was one of the more popular places where their patients went to see, and pediatrics. So if I had to limit it to one, it would be very difficult, but I would probably say it would be a toss-up between women's services and pediatrics. A parent should not have to take their child to ER in order to get school shots.
Oh, yeah.
And so, you know, we as a community need to look into that. A woman who needs pregnancy and maternal care should not have to go to ER for just a simple procedure. She should have a primary doctor. Your child should have a primary doctor. So those would be the two. And a fourth coming in at mental health.
Okay, thank you.
You're welcome.
Okay. Pam, I think you're up next on, no, excuse me. Got my alphabet wrong. Sue, you're up next. If in the budgeting process there had to be priorities set, how would you set those priorities?
I think I would like to see the community, like the Baptist, well, I guess they don't, it's not really the Baptist church, but the one I was familiar with in St. Luke's, be awarded maybe a bigger share. You know, my mind is going because I'm looking at the clock, and the urgent care place closes at 7 o'clock this morning, and I've got to pick up this 90-year-old woman. But in my opinion, and maybe I'm wrong, but I just think that the hospitals, they have physicians that are paid and staff that are paid, and these charitable clinics, they have volunteer doctors and people that don't get paid. And I would just like to see a little more help with them so that they maybe could expand their services. And I hate to do this to you, but I really have to go. All right.
Well, I understand, Sue, and thank you for taking time out of your busy
Okay.
day to appear.
Yeah, I hate to back out, but
I understand. Go ahead
gotta go.
and you can leave the meeting and
all right. Thank you. What do I have to do? Just,
assistance. Just click there's a leave meeting button there.
oh, I see it. All right. Thank you.
Okay, thank you. Okay, and Pam, this is your question next, the budgeting process. How would you determine priorities for funding?
Well, I think that Sue makes a really good point that the outpatient clinics are where we need to be spending money. The district publishes data on how many people have received district funded care and how many dollars have been spent on that care. And from that data, we know that primary care offered in outpatient clinics is the most efficient way to serve the population. So I would encourage allocation first toward primary care delivered at outpatient clinic, and next to specialty care delivered outpatient wherever possible, and hospitalization when necessary. But the most important thing is to avoid that emergency room. That care is extremely expensive. It's very inefficient. And if we can see people in primary care settings, we can avoid the use of the emergency room. It's not a responsibility of board members, but I would use that bully pulpit, I guess, to kind of look at social determinants of health, like transportation. How can we make it easier for people to get to where they need to be to get the care they need to get? And our clinics have done a great job of building in services like pharmacy and basic lab services right in the clinic, so that you go to your appointment, you get your labs drawn, you get your medications right there all in one fell swoop, and then you're done, saving time and money for everyone, including the people for whom it is difficult to get that afternoon off to go to the doctors.
Okay, thank you. Okay, next question. I think with the two candidates we have left first, and probably can do this very easily. Name the hospitals and clinics that receive funding, and what do you know about the services they provide?
Could you please repeat that question?
Sure. Can you name the hospitals and clinics that receive the funding, and do you know what services it is that they each provide?
Oh, gosh. Yes. So I'm going to do this by memory. I know, I'm going to do this by memory. Let's go by the hospitals first. So you have UF Health, and regional, UF Health Hospital Regional. You have Advent, UF Advent. Those are the hospitals, Waterman. You have out of the clinics, you have Community Health Center, you have Community Medical Center, and you have LifeStream. Okay. Can you please remind me of the second part?
What services do they provide? I mean, and maybe this is way too specific. You don't have to get way into the weeds with
Well,
thing, but generally.
Melody and I can both answer this because we've been to those
Which
places.
is
of them.
great, which is
We've talked to
impressive.
them and seen.
All of
I
them.
went to, Melody, I'm sorry, I'm going to jump in on you
Just
because
go
I
right
was,
Please
ahead.
do. Can we just have a group
Yeah, we're down
conversation?
to two people, so we can have more of a conversation. It sounds like you've done a lot of this work together, so.
We have, Pam is
Good
my
collaborators. We're
partner
good
in crime
collaborators.
since the beginning.
I just want to sing the Community Health Center song.
Mm-hmm.
I am
Yes.
so impressed with that clinic and the
Yes.
thought that they have put into meeting the needs of the patients that they see. They're the ones who have the lab on site and the pharmacy on site. And it is true that a lot of their providers are volunteers, which I just find kind of shocking that the quality of care that they deliver is delivered by volunteers. And that just tells you the passion of the people who are involved in delivering that service. I know that Lifestream is another one. They're doing such innovative things there, taking vans into the community to deliver mental health care in the community. Because
Yep.
when you're in crisis, you can't necessarily find your way to Lifestream. You need Lifestream to come to you, and they're actually doing that. So, Melody, I'll stop now. I'll give you back your time.
Well, you know, I just adore Pam, and we've been on a mission. And regardless of what happens, of course, we want to win and get a seat, but this is not going to end. We still want to create community relations. And I'm not sure if you are aware, but Pam and I put together a forum, a hospital forum, whereas the UF Health CEO, Lifestream's COO, Rick Harney,
David Otati from Waterman.
Advent Health, who else was there? A community health center was there.
Melissa Sims.
Yep, all of them were there. And we just wanted to kind of bridge the gap between what the community was thinking and what is actually happening. Break the myths. And to begin with, it was with UF Health. There's this myth that if the hospitals need so much money, then how did UF Health partner? There had to have been some kind of money exchange. Well, no, that's not true. There was no money exchange. So what the benefit of UF Health partnering up with Leesburg Medical Center was to provide even more medical assistance, to broaden the services, to expand the locations. This was a good thing. And it's still non-profit. And so this is one of the reasons Pam and I went out to each one of them and we asked them, would you be interested in just speaking to the people? And we had about 100 people that showed up and spoke with Lifestream, and he's still talking to people that signed into our hospital forum.
That's great. I mean, and basically you kind of have just almost answered my last question, which is what have you done during your campaign to meet, listen to concerns, and formulate your plan to address all the constituents, which would be the constituents that are running these institutions, health institutions, as well as those who are getting the services and the community that's paying for it. So anything that you would do, I mean, it sounds like you had this forum. So if elected, are there other ways that you could engage the community? Have you thought about ways to engage the community and make them more aware of the issues that these facilities have, as well as the issues of those who are needing these services have?
So we have talked about, even if neither of us are elected, we want to do a podcast or some kind of video outreach to talk about just these kinds of issues. Like, what are the services that are available to you? What if you don't qualify for district services? Is there another way you can access primary care if you're uninsured? And it's not easy to qualify for those services. And then I think the The one thing that people don't know, which I wish that they did, and I didn't know before I started this process, but these healthcare providers, even the big systems like UF Health and Advent Health, they want to talk to you. If you have questions, they want to answer your questions. They want you informed about what they're doing because they really have quite a story to tell. Every single one of these funded agencies has an incredible story to tell, and it doesn't get told nearly often enough.
Gosh, I agree with you, Pam. And you know, when Pam and I started this forum, the stories that we heard were just, you know, I think that people need to hear the experiences from the patients and what the hospitals and the clinics are doing. So when we heard about Livestream, Rick creating that mobile to go into the community and do mental health check-ins, when Rick told us on the forum that men over 50 were the highest numbers that were committing suicide because they don't feel that they will be marketable or able to get a job after the pandemic. This is real life human stories. You know, when we, it's just when we're talking to Don Henderson, and he was hurt when he heard that people are thinking that he's receiving money from UF Health and there's some kind of secret financial collaboration when there was no money partnered together. When you hear reasons why, okay, they are maybe receiving 3 million from, or 3.5 million from the taxing district, but they still have to recoup about 25 million that they're paying for because, you know, they have to pay out of their own tax pockets. The money is not going to come just from the taxing district. That's only one small percentage. If you need a heart surgery, do you know how much heart surgery is? That's thousands of dollars that the hospital is taking the cost in that. And so when you bring it to life, when you create something whereas people feel comfortable and say, okay, let me put my CEO cap down, let me put my CFO cap down, let me put my COO cap down, let's just talk. What are the issues? How can I get you to know what we're doing? How can I get you here and servicing what you need? I think that's the main part. Going to the community. I think Pam and I realized that it's not just about sitting back. We needed to go to the communities and bring the community to us, to the hospitals, to the clinics. You have to create avenues that the community will come and learn.
Okay, very good. This has been a great dialogue. I've learned so much. I myself do not live in Lake County, but I feel very good about what I just heard is taking place with the tax dollars to support these vital services in North Lake County. Thank you for agreeing to participate. I just want the public to know that all candidates were invited, not all were able to participate. I want to encourage all of our listeners to think about voting by mail. You have until October 24th to request a vote by mail ballot in order to stay healthy. And of course, another opportunity, if you want to do it in person, is to vote early at any of the early voting sites. And just vote, and direct your friends and colleagues to vote411.org, where you can find information about the issues, the amendments that will be on the ballot. And it's not just those races at the top that matter. These important positions in our local communities are critical. And so that's why the League is on a mission to educate the voters about the importance of the race as well as the candidates running for these positions. So again, thank you very much. Thank you, Bonnie, for serving as timekeeper. And we'll sign off, and best of luck, ladies.
Thanks so much. Good night.
Good night.